Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.
Roberta Thelen of Bailey's Harbor is an independent candidate in the 1st Assembly District. The election is November 6th. Roberta, welcome to WisconsinEye.
Thank you very much.
You're an independent candidate. Why are you not an R or a D? Let's start there.
Well, essentially, when I decided to run, it was kind of a last-minute decision. I was checking out to see if other candidates with the Democratic Party were running, because I have typically voted and tended in that direction. And it was about 1 week before the election, and I didn't hear of anyone running on the Democratic ticket, but I hadn't really had an opportunity to get their endorsement, so I went online, printed up all the necessary paperwork. Some friends helped me circulate to get signatures, and I got everything into the Election Commission by June 1st and made it on the ballot. I thought, step one, see if I could do that much, and I did.
What do you consider the top issue in this campaign for you?
For me, it's, certainly environmental issues come up pretty high on the list of, are we really addressing things on a serious enough level to try to address that, we're having climate change, and there's a lot of concerns there, especially, our state, well, our district especially, between tourism and agriculture, those are, big parts of that, and climate change is going to impact that a lot.
Climate change is such a international issue. You think one member of the Assembly can have an impact?
Well, I think everyone needs to feel they have an impact,
Okay.
We're each one individual with one vote and need to be out there.
Your website indicates that healthcare is an issue for you.
Healthcare is another very big issue, yes.
How can we keep and maybe expand healthcare in rural areas?
From my perspective, it would be nice to get to that point that we have universal health care, either Medicare for all or whatever single payer options are. I think it would take a lot of study to get to that point. I feel that in our state, there's been a lot of pushback to even accepting what the Affordable Care Act had to offer. We didn't accept the funding, and we didn't set up any marketplace situations for people. But it's a real big stressor for people not having access to health care or having high costs to health care. We have a lot of people that work in the tourism business. A lot of people are seasonal workers. I also see a lot of people that take jobs that they really would rather not have just because they need to have health insurance. So I would like to see that out of the equation for what people have to navigate to make those decisions. I think healthcare should be a right, not a privilege, not just for the wealthy.
Does state government have a role in recruiting and retaining doctors and nurses and other medical professionals? Is that part of the function of state government, do you think?
I have not seen that in action at all as part of that recruitment process. What I have seen happen in healthcare is that we have insurance companies that are making a lot of our healthcare decisions, including, since I've worked in healthcare for 17 years up in Sister Bay.
Are you a nurse?
I'm an RN,
okay,
and my
you.
position is a care coordinator, and I work at Scandia Village in Sister Bay. And before that, I worked for 10 years in Arizona, which is where I got my nursing degree. But insurance companies are deciding a lot of what people can access, what kind of medications they can have. I mean, I have insurance companies denying people coverage or denying to pay for a medication. They need to find something that's on their formulary list or whatever. So there's a lot going on that insurance companies are really dictating a lot of what goes on in healthcare right now, which I think is not a good situation.
Do you have an issue raised with by caregivers? AARP estimates that 578,000 Wisconsin residents are caregivers for family members or neighbors, people they love. And so the question AARP asks is, would you support laws or regulations that call for hospitals to recognize family caregivers when their loved ones are hospitalized? Is this an issue that you've thought about, or no?
I'm not sure recognizing them on what level, for like financial compensation for their efforts?
I think the goal here is to make them, if they're not family members, kind of partners in the healthcare decisions for someone who's hospitalized. That's my understanding. Yeah, if you haven't heard of the issue, that's...
I haven't really, I know there's a lot of legal implications. There's who can be decision makers for people when they are needing to access healthcare.
Okay. State government and Delta Dental have a pilot program that provides dental care in clinics for low-income people. Should that remain a priority in the next state Medicaid budget? Have you heard about this program, this pilot?
I've heard of it just a little bit. We're kind of fortunate in Door County that our hospital in Sturgeon Bay also has set up a dental clinic that helps with some areas. I know that people that don't have dental insurance sometimes, and if they're looking at state funding, have to go as far as Milwaukee to get, dental care. So I'm in favor of anything that would provide reasonable services, that people couldn't otherwise afford. I don't know a lot of details about what Delta Dental is doing, but it's certainly a really important thing with people's overall health.
The gridlock, the impasse in the Capitol over how to pay for our highways in the future. What are your thoughts? How should we pay for highways?
I know already there's a fair amount of the gas tax revenues that are supposed to be going for that. And I guess initially I would start there. I would increase the taxes on gasoline, because then it's going directly to those people using the roads, and it will be anyone who uses the roads, whether they're residents of our area or visitors or tourists or whatever.
When tolling is discussed in the Capitol, your response?
No.
You're shaking your head no.
No,
Okay.
I lived in Illinois for a period of time, and toll roads would not be, I think, a good option at all.
Local governments have lived under levy limits to control property taxes for 14 years. Some local government leaders say this hurts their ability to provide services. Levy limits, keep them, loosen them, dial them back, or get rid of them?
I don't feel like I have enough expertise on that. I know, serving as a town supervisor in Bailey's Harbor, we do our budget every year, and we set the tax levy limit each year, and it's gone fine. I mean, I guess I want to know that everyone's kind of on an equal playing field for that, and I'm not sure what brought it all about, if there were just such excessive spending going on that they had to cap it. So I would need to know a little bit more about that. Right now, I feel Bailey's Harbor has done pretty well just staying within our boundaries financially. So,
state government has approved potentially billions in tax benefits for Foxconn, potentially, and now Kimberly-Clark wants Foxconn-type benefits. Here's my question. What should be the criteria for state government to help to help private companies?
Well, I think they're calling this pretty much like an incentive to, get those companies to keep their factories operating here in our state.
Yes.
Kimberly-Clark at this point is headquartered now in Texas, I guess. So, maybe they don't have as much loyalty, even though they started here in Wisconsin. I don't care for it. I see it as just another way of calling an incentive bribe to, financial motivation. So I'm not in favor of it.
Yeah, I think my choice of bailout was the wrong term because both are profitable companies. So I apologize.
Profitable, but
I
at
apologize
some
for
point,
that.
you know, I don't know with the facilities in Wisconsin for Kimberly-Clark, for example, are they just not profitable enough that they just want to move it elsewhere? I mean, I think we had another example like with Harley-Davidson closing facilities, and I think they're building something in Singapore. So, you know, even though they got some tax incentives as well. So it's tricky stuff.
The current state budget did increase fairly dramatically state aid to our K-12 public schools. Some local school administrators and superintendents say we need another big increase. Do you think we do in state aid to public schools in the next budget?
Well, I mean, I think basically the increase we've already gotten was to make up for a lot of the cuts that they had previously made. So I think we're playing catch up a little bit in that area. You know, I think numbers wise, we're fairly on target with how much we spend. But I think that, you know, it's interesting. I've talked to people, teachers, some of them more in my age group, that actually took early retirement because they were so concerned of what was going to happen after the whole Act 10 and all the changes that took place with teachers' rights. So, you know, I am always going to be in favor of as much funding as possible to improve education.
The choice, the voucher program, has grown from Milwaukee to Racine to statewide. Do you have a position on whether it should expand further or whether it should be continued?
I think it gets a little kind of shades of gray here trying to understand that it seems that some of the charter schools aren't held to really the same standards as the public schools. So I think there again, it needs to be more of a level playing field for, you know, making those decisions. I want to see education supported. I would like to see actually some of the models that we use in education become a little bit more progressive. You know, you can look at a classroom setting today and it's not that much different than it was decades ago. So I have grandchildren that report to me on a daily basis about what they think of how things are going at school. And, you know, they're not finding it maybe as engaging as I wish they would. I'm concerned about things like some of the attitudes and the bullying that goes on and things that need to be addressed to make education a more positive environment.
Big debate in Wisconsin involves our prison population. Some Democratic candidates for governor said we could eventually, potentially cut the prison population in half over several years. We have 2 prisons that were built in the 1800s. Do we need a new state prison, do you think, Roberta?
Well, I mean, it would only be if to upgrade facilities that are no longer useful because they're no longer safe. But my understanding is, I mean, I don't have the exact statistics, but that we have increased the number of people we incarcerate in this state by a huge amount in the past 20 or 30 years. So I think we need to be really looking at that and who's being incarcerated for things like nonviolent crimes, for possession of marijuana, which I have come out a number of times stating I think should be legalized.
Legalized?
And, you know, talking about revenue and money for funding highways and schools and a variety of things, states that have taken on legalization of marijuana and found an equitable way to tax that also have found a lot of financial benefit from that to overall improve their state.
State government set up $100 million in grants for school safety. Is that enough, or do we need to change gun laws?
I am in favor of changing gun laws and school safety. So I think we need definitely some more sensible gun legislation. I don't think any of those notions infringe on anyone's right to own guns or people that are sportsmen and hunters and all that. But, you know, assault weapons and bump stocks and all the different things, you know, this should not be something that we need to even consider having as that your neighbor is going to have an assault weapon or something. So
Do you want to highlight differences between you and the Democrat and Republican candidates in the district?
I feel like Joel Kitchens has been well liked in his position. I think that there's just some issues that people aren't addressing because they're may be too progressive or too controversial. You know, I think we really need to look at some of our practices in agriculture. Obviously, Door and Kewaunee counties both have experienced well contamination. Yes. So we're looking at a lot of cleanup efforts, but no one's really addressing the source and the problem and what we can do to have better practice agriculturally with the manure, the use of chemical fertilizers and pesticides and antibiotics and the CAFOs. And there's a lot that no one has seemed to really embrace to try to find those solutions. So.
Should there be a moratorium on CAFOs?
I think that we need to look very seriously at putting some limits on that. My understanding is there's been no permits ever denied to people that wanted to expand in that CAFO aspect of, you know, getting away from having our animals out there on the pasture instead of in confined spaces, the health implications and the ethical implications for me. I'm not happy with thinking of animals having to live out their lives confined in a little space with a concrete floor underneath them or gravel or whatever, but it's not the way I think those animals were intended to be treated. So.
Okay. Roberta Thelen of Bailey's Harbor is an independent candidate in the 1st Assembly District. The election is November 6th. Roberta, thank you for visiting with WisconsinEye.
Thank you very much.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.